So we talked about some of the, possibly some of the testing some people would need. They might need something like a uterine cavity assessment to make sure that there's no polyps in the uterus for a woman. Semen analysis is good to make sure there's no male factor issues.
That's right.
Typical blood tests for male and female partners to make sure there's no...
Well, basically what we ask is for what every international standard clinic asks for, which is HIV, venereal diseases, and hepatitis B and C. And sometimes if it's required, we can ask additional tests like for chlamydia and other stuff. But basically with those blood samples, we can go ahead and work with it. The endometrial receptivity or status, as we said, for polyps and myomas, for example, can be very easily assessed by a trained professional by ultrasound. Basically, most of the times we can get that in a very early stage of your infertility treatment. So it's usually not a problem there. And we also have to check on the patency and the easiness, if you permit the word, to get inside the uterus to do the embryo transfer. And for example, to a patency, and these kind of tests are very simple. It can be done in one day, and you get the results the next day. And there are common tests that can be used either for IVF or IUI. So we can set up very easily like a group of tests that we need for any kind of fertility treatment, and it will work for anyone. So it's pretty standard, that's what I'm trying to tell you, and very easily, there's no need for any specific equipment, and you can get done at home, at your home clinic, and they just send the results back, so it can save you travel here to get a first appointment.
And how about in terms of with women, they would typically also need to get some hormone testing to assure they're a good candidate?
That's right. For example, sometimes when we're talking about, if we're thinking that there may be a problem in ovarian reserve specifically, we could ask for an antimullerinal hormone or for the FSH, depending on which part of the world you're coming from. And that's mainly what we would need to know if we're thinking of doing an ovarian simulation, because that tells us that predicts us the chance of being successful in getting a number of oocytes needed for an IVF, or can tell us to adjust doses, higher doses or lower doses. But that's it mainly. Maybe if you're thinking about a patient that's not really ovulating, you probably need to get some other hormones. But again, it's not very complex, it's just routine.